Hello everybody. Today we are going to discuss about ICU Liberation Protocol. The bundle first will try to understand what is bundle concept. Bundle is defined as a small set of evidence-based intervention for defined patient segment and the population and care setting that when implemented together will result in significantly better outcome than when implemented individually. This bundle concept was implemented in other clinical setting and was found to improve patient outcome. So the list of bundle with evidence-based. So the bundles that commonly we are implementing in ICU are WAP bundle, center line bundle, surviving sepsis campaign. Now the another concept is post-intensive care syndrome. So post-intensive care syndrome is the constellation of new or worsen impairment in physical, cognitive, and mental health that may occur after critical illness and persist beyond acute care hospitalization. This syndrome can occur in survivor of the critical illness or family member. So this may be accompanied by socioeconomic factors such as loss of employment and the financial crisis. So post-intensive care syndrome is can be seen in family member and in the patient. This is divided into physical impairment, cognitive dysfunction, and psychological dysfunction. Physical impairment include neuromuscular illness like critical illness, polyneuropathy, myopathy, disuse atrophy, then joint impairment in the form of pain, stiffness, contracture, cardiopulmonary abnormality like pulmonary fibrosis, post-ARDS, decreased cardiopulmonary reserve, and deconditioning, metabolic bone disease, osteoporosis, nutritional deficiency, and anemia. Cognitive dysfunction include impairment in the higher mental function include memory, concentration, judgment, planning, visuospatial ability. And psychological depression include psychological dysfunction in depression, post-traumatic stress disorder, anxiety, and acute stress disorder. Now, intensive care unit liberation. The purpose of ICU liberation is to liberate patient from suffering both during and after ICU stay and decreases the post-intensive care syndrome. Uh, this agitation, pain, agitation, delirium are important problem in the ICU. So delirium is common in ICU and is associated with mortality and long-term cognitive dysfunction. Implementing the PAD guidelines into clinical practice improves the patient outcome and decreases the post-intensive care syndrome. So we'll discuss the symptoms and monitoring tool recommended by PAD guidelines. For pain, monitoring tools are critical care pain observation tool, numeric rating scale, behavioral pain scale. Then for agitation, Richmond agitation sedation scale, sedation agitation scale, and for delirium confusion assessment method for intensive care unit, that is CAM ICU, intensive care delirium screening checklist. Then ABCDE bundle overview. The A is assess, prevention, and manage pain. The rationale is evidence-based pain monitoring tool to evaluate need for analgesia. It's central to treating critically ill patients. Then B is both spontaneous awakening trial and spontaneous breathing trial. Daily coordinated spontaneous awakening trial and the spontaneous breathing trial decrease the mortality risk of ventilator associated events and the duration of ventilation. Then C, choice of analgesia and sedation. Alpha 2 agonist, that is Dexem, shorten the duration of mechanical ventilation and decrease the delirium compared to benzodiazepine. Analgesia without sedation safety decreases the duration on ventilator. Then delirium assess, prevent, and manage. Delirium in the ICU patient is a risk factor for mortality and the long-term cognitive dysfunction. Evidence-based monitoring tool can detect and prevent. Then E is early mobility and exercise. Muscle wasting occurs early and rapidly during critical illness. So early mobilization and exercise improves outcome in the critically ill patient. Then F is family engagement and the empowerment. Family member may experience stress, anxiety, and depression. Their active involvement in decision making and care may reduces the post-intensive care syndrome. Family center care exists for adult, pediatric, and neonatal ICU. Now, assessment of features of bundle with respect to the ABCDE bundle. Features of bundle, it consists of three or five intervention. If there are more bundle element, it becomes increasingly difficult to achieve high compliance. Then the another thing is about bundle is it should not include elements that vary in the applicability to individual patient. For example, back bundle. Each bundle element is relatively independent. If one of the element of care is not implemented for patient, it should not affect whether other bundle element are implemented. Compliance of bundle is measured using all or none measurement with goal of 95% or greater. The bundle is used in defined patient population in one location. The multidisciplinary care team developed bundle element should be descriptive rather than prescriptive. Now the features of A, B, C, D, E, F bundle, it has six intervention and is more of comprehensive care protocol. Application of certain element varies depending on if a patient is mechanically ventilated or not, especially BCE. The intervention of A, B, C, D, E, F are more interdependent than that of the standard other standard bundle. For example, E, early mobility and exercise depends on whether patient is awake, sedated, or in the pain. Partial compliance with ABCDEF bundle has been shown to improve outcome in multi-site subtle investigation. The patient population in the ICU patient is variable in terms of diagnosis and mechanical ventilation status. ABCDEF cannot be routinely applied to all ICU patients. Thank you, guys.